welcome to another Pet Radio Show podcast at petradioshow.com. Today our subject is everything you need to know or want to know or should know about feline FIV. So stick around, put your feet up, we're going to get started right now. Joining us now is Dr. Monica Rutter. Welcome to the show, Dr. Monica.
Thank you. Thank you so much for having me. It's an honor.
Now, today we're talking about FIV disease in cats. And for us laymen here, could you kind of start off by telling us what exactly is the medical definition of FIV? I mean, what is it?
Well, so FIV is a viral infection that only affects cats in this case, and it's called the feline immunodeficiency virus. It is a viral infection that has been probably very misunderstood for so many years, and it's likened so much to the human version of immunodeficiency virus that I think a lot of people just don't understand what it really is. But this is an infection that is caused by a virus that is a very slowly acting virus, and it does cause the cat to become eventually, over the course of the lifetime, somewhat immunocompromised, which is why people liken it to HIV. But it does have very, very dissimilar properties to HIV. So it's one of the main viruses that we test for when we have a cat of unknown origin, or it's just come into a veterinary practice or is sick and living outside. We really want to understand, have they been infected with this virus, because it may have an impact on their life going forward. So that's it in a nutshell. It can be very complicated, but the long and short of it is it's a cat-only virus that will eventually, in most cases, cause the cat to become immunodeficient or immunocompromised.
And what does that mean, immunocompromised? I mean, does that mean that at some point they're going to become real sickly and weak and be in pain and suffer, or?
Well, so that's the very interesting thing. So immunocompromised just means that the cat's natural ability to fight infection has been impaired or will become impaired. So it means that the cat may have an upper respiratory infection, let's say, that never responds to antibiotics, or is very difficult to get it to respond to antibiotics. Or it might have a skin infection that, regardless of how many veterinarians try to solve it, biopsy it, give it antibiotics, treatment, it doesn't resolve. So the virus itself affects the cat's ability to fight very routine infections with bacteria, viruses, parasites, fungi, things that a normal cat would encounter on a daily basis and be able to clear without much problem. Cats with FIV are kind of behind the game. They can't really fight it with full force, so they tend to succumb to infections more readily than a cat who's not FIV positive. So it's not necessarily a death sentence, but it does mean that the cat will have a harder time to fight something so minor, as a fungus, a ringworm, an upper respiratory mouth infection. They don't have the tools to get rid of those organisms and move on to a more healthy lifestyle. So,
I take it from what you said a bit ago, though, that this only occurs in its advanced stages over what's a pretty long period of time. It doesn't become apparent when the cat is first diagnosed with this disease. It doesn't immediately affect their immune system in most cases, right?
Right. So the general course of the disease is that, at first they get an acute infection, which no one may ever notice. They might go outside, get in a fight with another cat. They might have the transmission of the FIV virus, and it can make them, they can be kind of feverish. They don't feel well. Their lymph nodes may or may not be enlarged. They don't feel quite right, but they pass right through that stage. And then it kind of goes into this more slowly progressive stage where it can sit for years before it actually becomes a problem for the cat. And it's really difficult to tell when these stages are happening in most of the FIV positive cats. The really sick ones are either in the acute phase that have just recently come in contact with the virus, or they're in the terminal phase. So it kind of goes through stages of during the life of the cat, and it can affect every cat differently. There's no one course. There's no one definitive path. Just because you're FIV positive and you're a cat does not mean you're going to die in 6 months. I mean, you can be 15 years old before your disease process becomes apparent. So I think that's one of the most important things to understand about this virus. It's very unlike a lot of other viruses that we see in the cat, for instance, FELV, which is a lot more deadly, a lot more rapidly. But FIV can linger for years and years and years, and you never even know the cat is sick until you take it into the vet and you get a positive test. And then you think, well, what do I do with that information? How long has he been FIV positive? Does it mean I have to, euthanize my cat? There's so many unanswered questions. So it's really you have to look at each individual cat and kind of assess where they are in the stage of their disease, and not be afraid of it. It's something people are very afraid of because they don't understand.
How is this diagnosed by the vet, by you?
Well, it's a really easy diagnosis to make, because the test that we use is looking for antibodies that are produced when the cat comes in contact with the virus. So it's a very specific test. It's probably one of the most accurate tests. A few drops of blood, and we're looking for those antibodies. And it's inexpensive. It's rapid. But now the problem is that the infection itself may not become apparent with antibody response for 2, 3, 4, 5 months after the contact with the FIV cat that they are exposed from. So diagnosing it in the early stages sometimes is difficult, but with most cats it's 3 drops of blood on a snap test at the veterinarian's office, and you get the results in 10 minutes. So we don't have to go to a lot of difficult, expensive lab tests to get this result, and in most cases it's considered relatively accurate. The only caveat to that is there has been a vaccine introduced in the last 10 years, 15 years, and the vaccine, unfortunately, will cause a response that will, the cat will test positive for FIV, even though they're testing positive for antibodies made in response to the vaccine, not the virus itself. So that has been a little difficult to interpret. So there is another test we can use now that can decide, is that antibody to the vaccination that we gave, or is it to the actual virus that the cat came in contact with outside, through fighting. And fighting, that's the most common way that cats pass this virus amongst themselves, through blood and saliva contact, through aggressive fighting behavior. So usually these are the intact males.
I was told by someone outside the veterinary world that in order for a cat to catch it from another cat, it has to be a very deep bite wound. Is that accurate? Or?
Well, I guess there's probably some truth. I don't want to say that it always has to be. I mean, it really depends. Some of the fights that you see in these big tomcat intact male cats, the wounds actually aren't able to penetrate very deeply because of their thickened tissue and their big cheeks and their very sort of ironclad skin that they have. So I think I would potentially argue with that a little bit. If you can get penetration of a canine, which is not a canine tooth, which isn't that difficult, and you're going to inject some saliva into the tissue of the other cat, I don't know that it has to be so deep, but I do think that in general we say that aggressive fighting is really the way, not play fighting. So if your 2 cats wrestle in the middle of the living room and one is FIV and one isn't, is there really going to be transmission with some sort of harmless contact but not really biting? Probably not. It's when the cats give each other abscesses. They're getting those canine teeth deep into the tissue and they're transferring that saliva. That's really where we see the transmission of FIV.
Well, maybe I guess I kind of exaggerated it a bit then when I said very deep, but it has to be a bite that penetrates the skin.
Correct.
I take it, right? Yeah,
yes,
okay.
And if a cat goes up and kind of mouths another cat, they kind of do that play fighting thing they do when they posture with each other. That's not a transmission risk right there. But really heavy-duty fighting that goes on with intact males, they get some pretty serious wounds. And, as evidenced by the abscesses that I'm sure the listeners have had to take their cats in for $500 for an abscess on the face or the leg or whatever, because those teeth can do some serious damage. So that's really how it transfers, and it's not a casual contact. You can't have an FIV cat walk by another cat or share a water bowl. All of those myths have kind of been dispelled that it's any kind of contact with an FIV positive cat will get you infected with FIV. That's really been disproven, and thankfully so, because the more we understand about the disease transmission, the more we will not be so afraid of it and make decisions that are hasty in so many cases.
So it can really only be caught by another cat. It can't be caught by another animal. If a raccoon
Correct.
bites a cat or something, he's not going to get it. Or
no, exactly.
I presume it's not contagious from a cat to another animal species either, or to humans, right?
Correct. Right. It is species specific. Most viruses are specific. I mean, there have been some cases in the news lately where viruses have transferred species. But in this case, this feline immunodeficiency virus is specific to the cat. So he cannot give your dog, an immunodeficiency virus. He can't give it to your child. If you're HIV positive, you can't give your virus to your cat, and thereby your cat obviously can't give it to you either. So it is specific to the cells of the cat. So, and again, the casual contact thing just does not occur, the casual transmission. So it's a pretty, it's a contact sport virus. It really is. It takes some serious wounds to transmit it, which is fortunate. Now, the only other way one of the other primary ways that cats can contract FIV is when a queen or a female cat, a mother cat, transfers it through her milk, or in utero, she can transfer it to her kittens. But most of the time, kittens that are testing positive have actually just acquired the antibodies by ingesting the colostrum, which is the first milk that comes out in the first 18 to 24 hours. They're getting antibodies from their mom, and if the mom is positive for FIV, she's going to pass those antibodies on to her kitten. And those kittens will test positive, but luckily, most of those will be able to clear out that antibody out of their system by the time they're 6 months old. So they're not truly infected with the virus itself. They're just testing positive for the presence of the antibody. So that's, it's a really interesting fact. A lot of people would come into private practice with a new kitten that they just found on the street or someone gave it away, and it tests positive for FIV. And you have to really understand how the FIV virus works. That kitten, so let's say it's 3 months old, that kitten did not go out in a gang of kittens and get in a fight with a tomcat and get FIV, right? He got it or she got it from either passing through the mom's birth canal, that's another mode of transmission, or nursing from the mom. And what you were detecting on that test are antibodies, not the virus itself. So the good news, and I wish more veterinarians understood this, and I think we weren't taught in school a lot of the nuances of this virus. I think back then, most of us who graduated, 15, 20 years ago, we didn't have access to a lot of the information. But those kittens are considered falsely positive until they're 6 months old, because it takes 4 to 6 months for the kittens to clear their mom's antibodies out of their system and produce their own antibodies.
Wow, how interesting.
So that test will be positive. And it's tragic. So many kittens are euthanized every single year in veterinary practices, shelters, all over the world, because they're testing positive for FIV, and they're assumed that they actually have the virus when in fact they just have the antibodies. And they're harmless. Antibodies themselves are harmless. It's the virus that we have to worry about, not the antibodies. And so you really have to understand what you're dealing with when you look at FIV.
I would think.
Did you know that?
No, I didn't know that at all. I find that so interesting and a little scary. I would think across the country, shelters themselves probably don't know that either, and are probably having kittens that do test positive that are under 6 months old, I guess.
Absolutely.
are just euthanizing them needlessly.
They are. And to their point, it's not their fault in shelter settings, especially. I fault more the veterinary practices should know better. But the shelter settings, they don't have the luxury of holding on to these kittens for months at a time, hoping that they're going to clear it. Right? They have a population explosion, and they have to eliminate the ones that they think are sick and not adoptable. I completely understand that point. But when you have a veterinarian in private practice who gets a kitten that comes in that's testing positive at 3 months of age and instructs or counsels the owner that this kitten should be euthanized immediately, that's where my heart kind of stops. And I think you've got to understand how it works before you condemn an animal to death for something that if you gave it a month or two, you'd be surprised more than 50 to 60% of these kittens will actually clear it out and become negative.
No,
it's frightening.
Well, I would think so. Now, a while back, earlier in our conversation, you mentioned something about a vaccine. Now, were you talking about, how this vaccine kind of created a false positive? But were you talking about a vaccine for FIV or a vaccine for something else that was doing this?
No, there is a vaccine for FIV, and that was introduced probably. I remember being on that, but I don't know, in the early 2000s, I think it was introduced. And the idea was that we would take at-risk, free-roaming FIV, cats that were living outside at risk and vaccinate them against the virus, hoping that would decrease some of the incidence of the virus or decrease the transmission of the disease or the severity of the disease. And the problem with any vaccine is that it forces the body to produce antibodies against the virus so that next time it sees the virus, it knows to go get it, right? Antibodies are our protective mechanism. Well, the problem is that the test that has been developed that is used, that is so specific and accurate, is testing for antibodies. So now they've had to develop a separate test to decide whether the cat who's testing positive may in fact have been vaccinated against FIV. It's not a routine vaccine. It's very expensive. It requires a series of 3 vaccines, and not very many people elect to do this vaccine. But let's just say there was someone out there who did the vaccine, and then their cat was picked up and taken into a vet, found as a stray animal, and there's a test done, and the cat comes up positive for FIV. We have no way of knowing, because we don't have any history on the cat if it just comes into our practice. We don't have any way of knowing. Could that cat have been with a very proactive owner who vaccinated against FIV, and that's why the test is coming up positive? So then the next step is a more costly test to decide. And a lot of vets don't think about it. They don't really know the FIV vaccine is out there because it's just not one of the core vaccines that we use in general practice. So, there's a lot of pieces to this puzzle, and those that aren't really clued in on what all those pieces are really forced to make decisions that may not be very well thought out sometimes.
Huh.
So,
So I had no idea there was a vaccine out there. I thought I had read all over the internet, even from veterinary websites and so forth, that FIV that there's no treatment, no vaccine, no cure, no preventative other than keeping your cat indoors. But that's not the case. Does this vaccine work?
Well, here's the problem with that. So after the vaccine having been out for many years, and I've been to many conferences, feline conferences, where we talked about it initially, and I got on the bandwagon, and I was vaccinating some of these high-risk cats, and then more studies were done that showed that there really wasn't much of an impact with the vaccination, and there were more problems that the vaccine was causing false positives on the test, and that fewer veterinarians thought to themselves, is my client going to want to spend that extra money now to get the next test to decide if it was infection or vaccination? So I think it was a good idea at the time to come out with an FIV vaccine, but it hasn't really proven to be incredibly useful. Now, to your point, yes, there is no cure for FIV. All we can do is manage the disease and, kind of protect the cat from exposure to things that might really cause severe disease. So a normal cat who gets a cold, not a big deal. A cat who's FIV positive, that's in that sort of later stage of the disease, it might even kill the cat. Pneumonia could kill the cat. Sinus infection, some kind of intestinal disease, diarrhea, all those things that are normally so easily gotten rid of by a healthy cat's immune system can be gotten rid of by the FIV positive. So there isn't a treatment for the disease itself, but you can manage. You can manage the cats. You can keep them inside, which most importantly, I think, reduces the transmission or their exposure, not transmission, reduces their exposure to other parasites, bacteria, viruses, fungi, things like that, fungi. And then secondly, we don't want that cat going out and spreading it to other cats. So keeping the cat inside, regular vet checkups, just to kind of see how things are going, and treating things proactively. If you have a cat that's having a lot of diarrhea, we might really be heavy on probiotics or put them on a different diet that supports their immune system. And there are some other drugs out there that have recently come out that are trying to boost the cat's own lymphocyte production to help them fight these infections. But there ultimately is no cure. But the good news is the disease is so slowly progressive in most cases that the cats can live a very, very long time. 8, 10, 12, 15 years is not uncommon in the vast majority of FIV-positive cats. That's something most people don't realize. They think my cat has FIV is going to die in a year. Well, no, probably not. Probably not. Maybe.
Now,
depends.
At what point? So an FIV-positive cat may live to be 15 years old or older.
Absolutely.
But do the advanced stages of the disease appear towards the end of the cat's life, or more towards the middle, or whatnot?
Hard to say. Every cat is going to react differently, and I think the amount of exposure, the amount of virus, the viral load, as it were, is going to be important too. If you have a cat who was passively infected, through maybe sexual contact or one bite wound when he was a year old, may not have as much of an issue as one that is a cat that's been outside fighting for 4 or 5 years as an intact male and is getting exposure repeatedly and is not healthy, to begin with. So I think there's no one course that's gonna really apply to every cat, and I think that is so important for people to understand. You cannot just take a blue dot on the left side of an ELISA test and say, my cat is going to die because he's FIV positive, and my cat is going to give it to every other cat in the world, and my cat is going to give it to my dog and to me. It's not going to happen. Your cat will die eventually. All cats die of something, and many of them die from things that aren't related to FIV. We cannot definitively say that the cat who died, who was FIV positive, died specifically from the FIV virus. Did it impact the disease that the cat already had? Probably. If the cat gets cancer or some kind of tumor that normally the body would have a better chance of fighting, the FIV can impact that. But did the FIV cause the cat to die of cancer? Not necessarily. It's just really hard to make that connection. And there are cancers that are more commonly seen in FIV cats. Lymphoma is a big one. Squamous cell carcinoma, tumors in the mouth, very common in FIV cats. But we cannot blame every disease that an FIV-positive cat gets, I think, on the FIV itself. We just know that their body is compromised. They can't fight it with their normal cells that are innate to the cat. They can't do it because they've been wiped out by the FIV virus. So we have to do things to support them, good nutrition, keep them inside, keep them healthy, do all the things to make sure that the cat has a fighting chance against the virus for however long it takes for it to during the disease.
And during the progression of this disease, the cat is not in any kind of pain or discomfort, is he?
No, I don't know. I'm not a cat, but I usually what they'll have, I don't know. I know a lot about cats, but generally I would say painful. I don't think so. Excuse me. There may be, I think there may be some annoyance for some of the cats. They get a ringworm, they get a fungal infection, let's say, and they're itchy, and they can't clear it like a healthy cat, so they're itchy more. Or they have diarrhea, and cats are very fastidious, and they don't want to be dripping diarrhea everywhere. So it may be uncomfortable to have diarrhea, but the long-term FIV is not painful. I don't think.
Well, who likes having diarrhea? I don't.
I know, but those are some of the things that we see with FIV cats are the chronic diseases that no matter what you do, no matter how many tests you run and fancy things you do, they're just going to have itchy skin. They're going to have diarrhea. They're going to have red gums. They have bad dental issues a lot of times, and so we try to address the things we can do something about. We can clean the teeth. We can pull teeth that are bad. We can keep them on probiotics, healthy diets, things like that. But, FIV doesn't have a specific progression. It doesn't have a specific sign. It doesn't have – it's sort of a big catch-all for immunosuppressive illness. So I think that makes it really – that's such an important thing for people to understand. I'm so glad we're talking about this. It's just it's amazing to get it out there.
So for someone that has an FIV positive cat, or may even be considering adopting an FIV positive cat, that the disease as it progresses over a period of several years, it's not incurring any additional medical costs for the pet owner during that time, right? All it means is that very slowly over a period of time, in most cases, that the cat will have a harder time fighting off diseases, but it doesn't. There's no ongoing special. What am I trying to say? Myself as a cat owner, I'm not going to be facing big medical bills until the cat perhaps is in its most advanced stages, right?
Well, I think that's really owner dependent and veterinarian dependent. If you take on an FIV positive cat and you understand the natural progression of the disease, and you are willing to just kind of support the cat in the best way you can through its lifetime, then no. But there are many veterinarians who are going to want to chart the progression of the disease. They're going to do repeated blood panels. They're going to want to watch that lymphocyte count and watch their red blood cell count and try to intervene whenever they can. I mean, there are things that can be done, but I'm not sure that any of the things that are tried are really impacting the outcome. I mean, I don't know if we really know, but you could, if you were the type of owner that would do anything you can do for your cat, you may investigate antiviral treatments. You may want to go in for a blood test every 6 months. But the thing is, it's not curable. So all those things, why for well-meaning owners, are wonderful. But I don't really think that most things out there, with the exception of some of the brand new things that are out, really impact the course of the disease. The disease is going to progress as it does to its end result. And again, some cats will die from something completely unrelated to their FIV. Right. So, yes, medical bills for some can be very, there can be much of a burden if they don't really understand what they're getting themselves into. But if you take on an FIV positive cat, let's say, and you understand this cat's going to have issues, and you're willing to just let that cat have the issues, knowing that his lifespan is not going to be the typical healthy cat, you can have a wonderful relationship with an FIV positive cat. And you don't have to be scared about it. And if you work with a veterinarian who understands FIV and respects the fact that all those blood tests and antiviral treatments, really may or may not change the course of the disease, I think it's a great relationship.
But what would the point of all those tests and blood tests be if the cat's not in any pain, he's not suffering, and ultimately you can't do anything to change the course of the disease anyway? What is the point in spending all this money over a period of years and all the stuff that you mentioned?
Well, that's a really loaded question. I wish I could answer that. I mean, just in my experience, I don't do so many of those tests to kind of to track the course of the disease, because I know ultimately what's going to happen. But I think the point is for owners and veterinarians with not as much experience, they're going to want to understand it. And I think if we really understood how it worked better, we would be a lot better off both in the human field and the veterinary field as far as immunodeficiency viruses. So, That's a really difficult question. I promote the adoption of FIV positive cats because you cannot judge how long they're going to live, and you can't assume that it's going to be an expensive lifetime. And I mean, having a cat or dog in general these days can be a very expensive proposition. But just because it's FIV, I don't think that necessarily means that it will be more so. But again, the owner needs to educate him or herself as to what really needs to be done.
Well, that's pretty much what I was getting at, is that an FIV positive cat, for the most part, doesn't really incur any more medical costs than
any other cat.
Than any other cat, than a non-FIV cat, right?
Correct. Because non-FIV cats can have diarrhea, and they can have lymphoma, and they can have bad teeth. It's a cat thing. But the FIV, does it add a complication? Well, maybe for some. It means, try to keep them inside and get them checked up every year. And if you start to see your cat is wasting away rapidly, and it has FIV, you'd really, what would be the point of trying to figure out what the underlying cause really is? You already know he's immunodeficient or immunocompromised. I don't know. I guess I just look at it from a different side, but I don't think you have to necessarily be afraid of your veterinary expenses if you have an FIV positive cat. And again, education is the key. Owners need to know what it means when they go into the doctor, so they're not convinced to do every test. And I'm not faulting any veterinarian who wants to be thorough and understand, because the more research we do, the more we understand. But it scares people away from adopting these cats because they think that they can't afford it. And that's really sad, right?
Yes. Let me ask you another question, as it may be kind of hard for you to answer as a veterinarian. But do you think any veterinarians in doing all regimen of tests and so forth are motivated at all by the income it represents for them?
I can't answer that question. I can't answer that. I think there are going to be some who are motivated by that in every field, and I don't think ours is any different. Yeah. But I think, again, if the owner wants to protect him or herself against that, do the research. Read the Cornell, College of Veterinary Medicine Feline Health Center website. There's so much good information out there for pet owners, so they know before they go in, what am I dealing with, doctor? And then they can not be sort of stunned when the doctor says all these bad things are going to happen. They can say, well, in my research, I read that, such and such, or I read that you can have a FIV positive cat with a non-FIV positive cat. There's studies out there that are published that, prove the point that if you don't know about FIV, you're going to make bad decisions. But if you do know about FIV, you can make good decisions and healthy decisions for these cats. So, I hope there'll be some references left for anybody who's listening, because really there's great information, really great information, very pro FIV. Adopt an FIV cat. That's like the best message. Please.
Well,
don't euthanize them.
Why do you think that so many shelters and veterinarians so routinely euthanize these animals?
Well, I think for all the reasons we just discussed. I think, number one, lack of information, lack of current information, fear of the unknown, fear of medical bills, worry that there is going to be transmission that that can't be contained. I mean, I've heard so many things, so many mistruths and rumors, and I'm stunned that in this day and age people still believe the way they do. But mostly, I think it's fear. I think we had a period in our country where we were very afraid of HIV positive people and people with AIDS. And unfortunately, FIV has been likened to HIV, even though they're very dissimilar. And so people are afraid of that. They're afraid, I don't want to have an immunocompromised cat because it's going to look just like an AIDS patient, that I've seen in all the documentaries. That's not the case at all. It's sad that there's a connection, because it's a bad connection between the two. So I think shelters don't have a choice. Veterinarians do have a choice, but I think they have to convince their owners that it's safe. And if they don't really believe it is, then how are you going to tell your client in good confidence that you think this is okay to do?
Now, you're really the only veterinarian I've ever met who runs their own shelter and rescue for cats.
That's kind of scary. I hope I'm not the only one.
I've never heard of a veterinarian becoming an activist for saving and adopting out cats. I mean, I think it's wonderful. But what I was curious is how often do you see FIV cats come through your shelter?
Oh, it's crazy, and that's one of the main reasons I started my foundation. But I get calls daily from practitioners all around Northern California, where I live, as far down as Southern California, shelters, people who have just discovered that a cat is FIV and they need to get rid of it. Oh my gosh, it's horrible. It's an emergency. I got to get rid of my FIV positive cat who I've had in my house for 8 years. You know, I think that I need to have a sanctuary so that the cats can be safe, and then we can start educating people that they don't have to be afraid. And that's kind of what drove me to do what I do, just to give them another 5 minutes for everyone to take a breath, do some research, understand FIV. And a lot of times I have people that will surrender a FIV cat to us. I send them to some websites, they do some information, and you know what? They come back and get the cat because they understand now. I don't have to be afraid. I don't have to be afraid of this FIV cat. It's okay. So that's really my purpose is, save them and educate people. So that's why I do it. I hope there are more people out there like me. I'm sure there are. You just don't know them yet. I hope so.
How successful are you in adopting out FIV positive cats?
We do a fair amount. I would say we do about 100 a month, cats in general, 125, probably 10 to 15 FIV positive cats a month, so about 10%. And that's really good. And these are FIV cats that we send home in homes with non-FIV cats even. You do not have to worry about that casual contact if the cats get along really well. So we have very good success with that. But we do keep them separate just for public perception. They have their own enclosure. But I don't really think it's necessary. If they all cohabitate beautifully, you really don't have to worry about that. So FIV is becoming kind of the thing now. I'm really very excited even to have a show like this, talk about it, get it out there, have people think about it just a little bit more.
Well, we try to be cutting edge here on Pet Radio.
Well, you are.
Absolutely. Well, please tell our listeners what the name of your organization is, your shelter and your foundation.
All right. Well, we're called the 9 Lives Foundation. I guess we sort of stole that from the fact that cats have 9 lives, and I think at 9 lives they really do. But we are located in Redwood City, and I think we would qualify as probably the only true no-kill shelter. We do not judge a cat based on his FELV, FIV status, or his behavior, or his medical profile. We try to give every cat that comes in a chance to get adopted or just to live in a foster home or something like that. So 9 Lives kind of says it all for me, and I've been doing this for about 11 years, and proud to do so, actually, very proud.
Well, that's wonderful. And I think you told me that, am I remembering this correctly, that you have typically over 400 cats in your facility?
At a time. We do. And unfortunately, at a time, the building is quite large. It's about over 5,000 square feet. It's kind of a big warehouse space. But sadly, we currently have more FIV positive cats than we've ever had. And I don't know if the word is getting out that we will rescue FIV cats, but we'll have an influx of FIV, 4 to 5 cats a week sometimes, especially from Southern California, where they're finding it difficult to find any sanctuary for FIV. So, as a no-kill shelter, you have to realize the population is going to be very large because we don't have a time limit. So we have to work very hard to move the cats out, but I try not to turn anyone down. So we use a lot of creative foster home methods to get some of the cats out of the shelter, because the shelter is not a bottomless pit, though sometimes it feels like it is.
My goodness.
Yeah.
I can't even imagine what 400 cats. I interviewed on this show Cat House on the Kings. Do you know those folks?
Mm-hmm. I actually am very familiar. I did some veterinary work for them a couple of years ago, so I'm very familiar. Mm-hmm. Yeah.
And
Linnea
I know
and I are good friends.
Yeah. Oh, that's wonderful. Say hi.
They have
to
a lot of
her
cats. They have more cats than we do. They have a lot more cats than we do.
I was going to say they have. I think when I talked to her, and this was a couple years ago, it was 800 or something. I think they're well over that now. But
right. Well, they have a very. They're lucky. They have an outdoor area. They have a lot of acreage, so a lot of the cats are able to just sort of roam around this beautiful property. So, they're very, very fortunate to have that piece of property. We in the city aren't so fortunate to have the same kind of setup,
right.
But we do our best. Yeah.
Well, you're doing.
So I'm not a cat hoarder. I promise. I'm not.
No, I'm sure you're not. But that's great. and you must have a website. What's your website?
Oh, it's a really hard one. 9livesfoundation.org, and that's 9 spelled out NINE. Lives Foundation, and we've just started building an FIV page, and I try to have some links for potential FIV owners and maybe people who currently have FIV cats to link to read the facts and read the studies and get encouraged that they're really doing the right thing by keeping those FIV cats in their homes and not destroying them. It's an important message.
All right. Well, thank you so much for being with us today and sharing this important information with us too. I'm right there with you. I believe that this is a very important issue that every responsible cat owner should be more educated on, so that fear doesn't become a part of one's decision on how to manage these type of cats and whether or not to give them a home or not. And thank you so much for all.
They all need homes. Yeah.
Well, thank you so much for all the wonderful work you're doing to help these animals in need.